Hey, good afternoon, everybody. This is Dr. Stewart with McKinney Chiropractic here in Bellevue, Florida. As you know, we've been a trusted chiropractic and natural healing practice here in the Bellevue area for the last 40 years. One of the things I'm excited to come and tell you about today is that we have a new technology in our office that we've been getting great results with called StemWave therapy. So I'm here today to kind of tell you a little bit about it. One of the great things about it is it's non-invasive, okay? It doesn't have any needles, there's no knives, no surgery, and we get great results with that. One of the target tissues that we're looking at with this are knee and shoulder problems. These are the things we're getting really great results with. I personally am partial to knees because we've been seeing such great results with knee problems. One of the things with StemWave therapy is that it is a shockwave therapy. As a matter of fact, it is a hydroelectric acoustic sound wave, all right? So there's been a lot of shockwave devices been on the market for a while, but a lot of those are merely superficial. This one here has been around in the States, is FDA cleared for a little over a year and a half. They've been doing this in Europe for the last 20 years. One of the cool things that we see, and what I love the most about this StemWave therapy, is we're able to qualify each patient before they're accepted for care. Some of the criteria that we're looking for is we want to see a 5 or 20% improvement in their symptoms with the range of motion, or that their pain decreases just in putting a small amount of waves in there. So what does that mean? That means that you could literally come in here for a mapping session and you could get some relief today. So with that, I'm going to tell you a little bit about how StemWave works. StemWave, as you come in for this mapping session, your practitioner is going to be doing this mapping session to where it is going to be looking for areas of inflammation. So one thing that's cool about the StemWave itself is that it is a diagnostic technology, but it's also a healing technology. So diagnostically, this thing is identify areas of inflammation. So during a mapping session, what you could expect is that your practitioner is going to be looking for 3 or 4 areas of major inflammation, and let's say the knee, okay? With that, we're going to find those inflammatory areas, and it's almost like it's a bubble in there, all right? And with that bubble that's like this, you're going to feel a little bit of discomfort when that shock wave starts to hit that, okay? Areas that do not have any inflammation, you do not feel anything. But when we find an area of inflammation, we're going to find some discomfort in there. So with that bubble that's like this, as we put about 20 or 30 waves into that area, we see that bubble starts to shrink in size. As that starts to shrink in size, your practitioner is kind of going around the borders of that bubble. It starts to decrease something that might be like a 7 in pain when it first hits it. When we go back over it, it's likely going to be a 1 or 2, or maybe we don't find it at all. So this is where we're getting these great results where patients can get this mapping session and they stand up and they have no pain, or their pain is significantly decreased. The best part about this is that it's really not a lot of treatment. And with that, we're seeing that patients that get the treatment, they are finding that it is increasing the blood supply. So it starts something called angiogenesis, to where new capillary beds are laid down, and we start to see an increase of blood supply to these areas of arthritis. So why do you think you get arthritis in these areas? Well, we get arthritis in there because there's a lack of blood supply, and inflammation sits in there, it turns into scar tissue, and then we get degenerative changes in there. And the best part about this is the regenerative healing that comes along with this. We start to see the recruitment of sternal and mesenchymal stem cells to the area, and over a period of time, we're going to see that these tissues start to heal. So if this is something that you're interested in, we are doing some mapping sessions, and we do it at $49 for a mapping session to see if you qualify. I'm really excited to bring this new technology to this office, and I'll tell you, this is probably one of the funnest things in a long time that I've been able to do, because the results are absolutely remarkable. So if it's something that you're interested in, please contact the office. Our phone number is 352-245-8955, and we'd be really excited to see if it's something we can help you out with any of your aches and pains, your knee or shoulder problems, and look forward to hearing from you soon. Take care.